Hi guys, welcome to another video. Today we'll be talking about class 3 composite restoration and we'll be restoring this canine. So you can see a white spot lesion that is there between the canine and the first premolar. So we will start with a round wear under water coolant. As soon as we remove the enamel, you can see the caries lesion. So now whenever we talk about the removal of caries, we recently have been following the principles of biomimetic dentistry. That is a beautiful article which tells you specifically which areas to remove and how to proceed in deep cavities. I'll be sharing the link later on in this video. So what we are in according to these principles, we want to establish a peripheral zone of a healthy dentine to which we will bond. So instead of going deep and excavating on the pulpal wall first, we will be cleaning the peripheries of the caries lesion first. The dentino-enamel junction should always be caries free. So if you follow all these principles, there are lesser chances that you are going to end up in exposures. First and foremost is that you should check the vitality of the teeth and ask the patient for the symptoms and establish that the caries has resulted in reversible pulpitis only. If at all you see radiographic lesions approaching the pulp and symptoms of irreversible pulpitis, then you will have to go for root canal. That is the criteria of deciding when to do a root canal and when to restore the tooth. So here you can see clearly that we are cleaning the peripheries of the caries lesion first. You can see I was cleaning. This is the article I was talking about. Now we've cleaned the caries and applied the rubber dam. We have applied the matrix band and the separating ring, which compensates for the thickness of the matrix band. We etch for 20 seconds, then we are washing the agent. Now we gently blow air to dry the cavity. We should not excessively dry the cavity. You can see the white frosted appearance. Now we are going to apply the bonding agent. This is a yellow light which is a filter to prevent the premature polymerization. So now we will apply the bonding agent to all the portions of the cavity, all the peripheries and the portions of the acquired cavity. In these 7th generation bonds, it is necessary to let the bond stay in the cavity for around 30 to 40 seconds before curing the bonding agent. These are self-etching bonds that you can use with a total enamel etch technique or only selective enamel etch technique. So after leaving it for 30 to 40 seconds, now we'll be curing the bonding agent. Then we'll be using a flowable composite and sealing the dentine first. We'll be applying a layer of flowable composite on the gingival seat and all the dentine that is there in the cavity. Now we'll be making the proximal wall so that we can remove the band and later on finish the rest of the cavity. On the gingival area, I am applying a layer of flowable composite and then a layer of packable composite will push this flowable composite into all the areas and make the adaptation of composite better. This is a sort of snow blow technique that you might have heard about. Now we'll be making this proximal wall. You can use an instrument or a micro applicator tip to smoothen and adapt each layer of composite to the previous one. walls of the cavity or the restoration. If you make it too high, then you'll need more time when finishing and polishing if the restoration is to be done. So here we're done with the making of the proximal wall. Now we remove the ring, adding the next layer and adapting it with a micro brush. After this step, we can remove the matrix band. We will use the saddle matrix here. Now the band has been removed and we'll be using a compute to fill the rest of the cavity. This will be adapted with the micro brush and hand instruments. Atmospheric oxygen from inhibiting the polymerization of the surface layer, we'll be using a layer of glycerine. We'll cover the restoration with glycerine and then make a final cure. If we don't do it, then you might have seen the composite restorations turn yellow after a certain amount of time. That is because of the uncured composite that is left as the last layer. Now we are using Softlex discs from 3M to refine or to finish our restoration. We'll be finishing the restoration with Softlex disc, and finally we'll be using polishing spirals and wheels from Dentsply to finish and polish our restoration. This time, so that you can see the minor details also how we are doing the things. Now this is the final polishing. Instrument, or you can use the 12 number blade also to remove the excess of the gingival flash that might have creeped in. Now this is the final polishing. You can use some diamond polishing paste also, or these instruments from Dentsply are more than enough in themselves. After removing or adjusting the high points, you can see a very